Hi, I'm Kaylee Ham, and I'm a patient care technician in interventional radiology. My role in interventional radiology is to connect with patients when they first get here, get them roomed, take their vitals, and get them prepared for their procedure. And when they're done with their procedure, I get them situated back in their room and make sure they're comfortable, and then take them out front to go home. I have been interested in healthcare for honestly as long as I can remember. I have always watched medical dramas or just always wanted to be in a hospital setting helping people. I was always told from my teachers that that was almost like my calling, and I have always resonated with that. So I actually used to work in the ICU at Thompson during COVID, so back in 2020. And then I had to take a step back when I got pregnant with my daughter. So I left healthcare altogether. I did a couple other jobs, and then ultimately wanted to come back to Thompson to further my education, further my career, and just get back into what I knew I always wanted to do. I enjoy everything about Thompson. The culture here, specifically the CARES values. We live by CARES values every single day. Commitment and service are my big ones that I think about daily. I'm committed to helping all of my patients. I'm committed to helping my coworkers. What we do in interventional radiology often is life-changing for people, so I like to be a part of that and help them feel comfortable and do the best I can for them. I learned about the Healthcare Education Fund from my director. She knew what my long-term healthcare career goals were, and she felt like this would be a good resource for me to be able to get there. Furthering my education to be an LPN not only means a lot to me, but it's who I am as a mom. My kids deserve more out of this life, and I also think I deserve more out of this life. So I don't want to stop at LPN. I want to get my RN, and that's the plan. It's just getting there.
The individuals that go through this program, any type of a nursing curriculum, whether an LPN, an RN, is a very, very intense program. It is nearly impossible to work full-time while you go to school full-time. Quite frankly, get the education and the needs and the grades that you need to be able to pass your exams and pass your licensing exams at the end. This program makes it possible so that an associate can still be the mother they want to be, the spouse they want to be, and the nurse they want to be throughout this entire program. It gives balance and it gives opportunity.
A challenge I faced was getting pregnant with my daughter in 2020 and having to take a step back, and then I also got pregnant with my twins shortly after that. So coming back was a challenge, but again, it was something that I knew I wanted to do. And shortly after coming back as a patient care technician, I decided that I wanted to get my LPN. What's helping me get there is the Healthcare Education Fund. It has been extremely helpful in supplementing my income so I can be at home studying and focusing on all of the important exams and trying to be successful in school, so ultimately I can stay at Thompson and further my career. My days are so busy. When I get home from work, it feels like I'm starting all over again. It's not uncommon that while my kids are eating dinner, I'm standing next to them working on a whiteboard trying to study for exams. After dinner time with the kids, it's usually bath time in bed, so I need to figure out how I can study during that and submit assignments while I'm trying to get them down for bed as well. Once the kids are asleep, I try to get back on my laptop, see what's due, see what's coming up, and what needs to be done when. My days are very hectic, but the Healthcare Education Fund has allowed me to savor time with my kids in between clinicals, labs, work, and all of my assignments. I have a child with cerebral palsy, so not having to be at work for so many hours a week does impact her by me being able to be home and work more on therapies. In between therapies, while she takes a break, I'm able to get back to my studying. My family means everything to me, which is why I'm doing all of this.
So without this program, a lot of these individuals would never have this opportunity. And this is an opportunity for you to make an incredible impact on the life of another human being.
If this fund wasn't available, I would still want to get my LPN and my RN. I just think it would take me a lot longer. I would still have to work full-time, if not more, to be able to support my family and my children. And school would kind of be put on the back burner.
you can make a difference not only in the lives of one of our associates and their entire family, but also in our community.
I will graduate this August with my LPN, and there's no way I would have been able to do this quick without the Healthcare Education Fund. Shortly after I finish my LPN in August, I will start right back up with my RN in January, which will take me 3 more semesters. I'm not sure what type of nurse I want to be, but I do know I want to be at Thompson.
This program will not exist without your support. And the more that we can get you to help us to invest in our human capital and in our Ontario County residents, the better off we're going to be. The better off we're going to be for the associates themselves, the better off the health system is going to be, and the better off our community will be meeting the healthcare demands of everyone.
To all the donors that donate to the Healthcare Education Fund, I just want to say thank you. Thank you for making it so I can still be a mom. If I had to choose between school and my kids, I would always pick my kids, but this is making it so I don't have to choose. There's so much more that I want to give to the community, this hospital, and my family, so thank you for allowing me to be able to do that.